Hello everybody, I'm Dr. Valeria Soltanik, and today I'm doing this video a little later at the end of our working day, and I want to touch today's topic on bruxism and grinding and clenching and TMJ pain. Since today alone at the office I had about 6 patients throughout the day that their main complaint was a lot of pain in the joint area, pain when waking up, and the sensation of the clenching and the masseter muscle, which is this muscle here. As I palpated, I noticed also very tight and too hard even. So the way that I do the examination also to check how tense this muscle here is, the masseter that runs here. So I go with these 2 fingers inside the cheek and I go like this. First, I like to demonstrate on myself so it's easier. I palpate like this and notice my muscle is soft, but on someone that has too much tension, this area here, it's going to be hard. Since when we chew, when we masticate, when we clench, this muscle here hardens, so it'll be here. If you do this right now yourself, you can try, and you do this, you're gonna feel this harder than the rest. And this is one of our strongest muscles in the body. It has a lot of strength because in order to bring the mandible up, you need a lot of force. And those people that at night involuntarily, like without even knowing or due to stress or any other environmental factor, they clench and they press and they grind like this, or they just press like that, they are damaging the joint and they're causing a damage and strain on the teeth. So another way to check yourself even, or for new dentists that are in school, yes, the strongest muscle is the tongue. This Nesto Landara said, and I agree, but I said one of the strongest muscles is the masseter. But yes, the tongue is the strongest muscle of the body. Thank you. So a way to palpate the joint area and to see how tense or hard it is, you go all the way here, and at the end of your last tooth on the bottom, there's going to be like a space. So you're going to put your thumb there like that, and you check how that is too. That's also one of the ways that I examine my patient. And if there is pain in that inside area at the end, also it is your joint. That's also a way for us to look for the area of the joint. So what are some solutions for TMJ pain, for the clenching and the bruxism? There's no way that I can tell. Thank you, Nestor, yes. There's no way that I can tell someone stop clenching, stop bruxing. No, you can't, okay? It is involuntary most of the time. Also, while we sleep, we do it without even knowing. So one way is to have a custom night guard. If you have access through a dentist to have a night guard, that it's going to be placed in either arch, either on the bottom or on the top. I prefer the bottom because just gravity holds it more, but some people prefer an upper night guard. So a night guard will be something like this, made of silicone. So as you wear it on one arch, you're creating a little bit of a height and relaxation of the TMJ area, the joint area. And you're also having the thickness of the silicone is going to act as a cushion. So it's going to be a sandwich of protection. So one follower said this is like an aligner. No, this is a night guard. It's an occlusal guard to protect your teeth from breaking and from the wearing, from constant grinding. And it's going to cushion and create a slight opening so that you have more relaxation in the joint area. So we call it, in the States, we call it a night guard or a Bruxism guard. And there's also a harder type for heavy bruxers, but it's by preference. I think most of my patients are very happy and successful with this kind of guard. And how often do you change? It depends how often, how soon you destroy it. So once you start seeing holes through it, if you're a heavy bruxer, that's when I say it's time to change it. Also, I have patients that wear it for many years and they keep it super clean, then that's good. But if you start seeing that the silicone becomes very discolored or wears off, so I think it's time to change it. What else? I have here a sample of one that's made in color because one of my patients wanted something colored, and I find it very helpful. Most people feel comfort, and it's a great way to protect your teeth. If your teeth are not well aligned, then I think it's very important to consider aligning the teeth so that the forces, the heavy forces that you're creating, are well distributed among the teeth. Because if your teeth are super malaligned and you're gonna have one tooth forward or backwards or where it doesn't have to be, and you clench and you turn like this at night or even during the day, that tooth will be easier to break, destroy, and lose the tooth. So very important to consider alignment of the teeth if you are heavy bruxer or grinder, or if you have TMJ problems. What else? I think that covers this topic in a little bit of a summary, so you can kind of self-examine and see if that pain you have here comes from your joint, and that's just the TMJ pain. But if you're a heavy bruxer and grinding, one more thing. If you think that you're doing that during the day, because a lot of people nowadays work from home or many hours in front of a computer, I think that you can also use the guard during the day if you feel that you're doing that action during the day. So it's not just for the night. So I hope this answers a lot of the questions that I get through email and messages, and also it's a topic that I felt very important to touch today, since today we had so many patients in just one day with the same problem. So, and also our last patient that had this problem came with a broken tooth because of this. So very important to take action before you have to take a bigger action or you get to a broken tooth. So thank you so much for watching my videos. As always, I do it for all of you. It's a pleasure to keep teaching everybody or informing. So so that you can be more aware of treatments out there or things that you can do. And together also with my brother, Dr. Fernando, we are also working on a Niger that can easily accessible to everybody so that they can use it, since some people, they're not so, they don't have the accessibility to see a dentist or have a Niger made. So thank you so much for watching wherever you are. Have a blessed day, have a blessed night, and I will continue to post videos to inform you and teach you. Thank you so much. I'm Dr. Valeria Soltanik. Thank you.